Hello everyone and welcome. My name is João Bardy. I'm a PhD candidate at the postgrad program in Sociology and Anthropology at the Federal University of Rio de Janeiro and a visiting scholar at the University of Southern California Anthropology Department. I'm really happy to be with you today to present my PhD thesis work. I've been working on the social life of generic medicines in Brazil. I'd like to thank both USC, my department in Brazil, and the Conselho Nacional de Desenvolvimento Científico e Tecnológico from Brazil that is funding my research. So, I wanted to start talking to you guys a little bit about the generic medicines in Brazil. Generics started in Brazil in 1999. They were a state policy that began with the furtherly no generic law, Lei dos Genéricos. This allowed the commercialization of generic drugs, which are required to be at least 35% cheaper than their brand name counterparts. But it's not unusual that you see them much cheaper in the market, reaching to 70%, even 90% cheaper than their brand name counterparts in pharmacies. The industry has developed throughout the beginning of the 2000s. So the market started with the approval of 177 generic medicines by Anvisa, which is Brazil's equivalent to the FDA. And over the years, the number of registered generics has grown significantly. By 2019, there were 3,000 valid generic drug registrations, and the market has continued to expand. As of 2023, the market size reached $21 billion with an expected growth to $38.2 billion by 2032. Generic drugs in Brazil also have some particularities, the main one being the packaging. Generic medicines in Brazil are required to have distinct packaging from differentiate them from brand name drugs. The packaging must include a prominent yellow stripe with the letter G to indicate it is a generic drug. Information about the active ingredient and its equivalence to brand name drug, clear labeling to ensure consumers can easily identify the generic nature of the medicine. They also can't have a brand name, so all companies they are producing one drug will produce it under the same name, which is the active principle of the drug. There are some key players in markets. So there are a lot of domestic and international players. Market is dominated by Brazilian companies. So Big Pharma in Brazil mainly started with the public policy of generic medicines. So you have companies as Medley, MS, Sigma Pharma, Europharma, and Axé Laboratories. And consumer trust is very high. It's been high since the beginning, and there's a rigorous quality control and bioequivalence tests that are organized by Anvisa that have helped build trust among consumers and healthcare professionals. So how to understand them? My approach was an ethnographic one. I was following things throughout the social life. I followed the generic drug from production, distribution until the end consumer. And employing an ethnographic approach, my proposition was to understand the generic drug in Brazil by following these objects through their social life. The following things is not new in anthropology. Works that follow the canastra cheese in Brazil by Dupin, the classic mushrooms at the end of the road by Tsing with the Matsutake mushrooms, the classic mince work about sugar economy, flip-flops, flowers, bananas, and tomatoes produce a robust set of bibliographies that delimit a methodological field, a way of doing ethnography with following things. But it's important to note that neither methodological nor theoretical paths are always the same. They depend on the object and the singularities of this object's social life and moral economies in which it goes through. So my field started over 18 months ago. I have collected a wide range of ethnographic and bibliographic material. This period has comprised a series of different activities ranging from one-off immersions in medical and retail fairs promoted by the pharmaceutical industry in Brazil. I have collected journalistic material, bibliographical research, and I've made 2 long-term immersions in different fields. One of them in one of the largest Brazilian companies in the sector, which I'll refer to you as Company G for ethical reasons, and the other field was in a municipal healthcare center in the city of Rio de Janeiro. So the first one focused on production, last one focused on consumption. At the beginning, I was interested primarily in the generic drugs object, so the generic drug by itself. But by doing this, by following this circuit of that the generic drugs go through their social life, I have understand that they articulate in a particular manner state, market, and health. Talking about generic drugs led me to think about how these 3 entities relate to each other in the making of generics throughout their social life. As I followed it through its social life, I came across different landscapes and actors operating according to different logistics. As a result, I felt compelled to use this analytical framework. Calling state, market, and health as entities is an attempt to account for the theoretical, material, and moral manifestations that I encountered throughout this ethnographic field. So this is just a quick example of what I'm calling these theoretical, material, and moral dimensions of these 3 big entities, state, market, and health. Firstly, I tried observing them in separate ways, like a theoretical way, then the material, then the moral. But it goes that they have different expressions that compile themselves. I talk about entities because I want to be accountable for all these dimensions. So, state, for example, I've been using anthropology of bureaucracy, anthropology of state to think about my material, which is paperwork, legislation, and regulation. Those are really concrete dimensions of how the state is operating, both inside the factory of Company G and in the consumer's life. They have this more morality. So I've selected a couple of statements to better express the moralities of these different entities. So in the state, I've selected Anvisa's mission statement, which is the FDA equivalent in Brazil, that reads, their mission is to promote and protect the health of the Brazilian population, acting with scientific excellence in the regulation of products, services, and environments subject to health surveillance, promoting access, reducing risks, and supporting the country's development in an integrated action with the unified health system. The market, I have used economic anthropology. The material dimensions are the generic as a commodity and money as well. The morality here I've selected comes from IQVIA mission statement. IQVIA is a software that is used globally from generic pharmaceutical manufacturers and so on. And it was a big part of how Company G understood the market in Brazil, because it was their main tool of work. So IQVIA's mission statement reads, to us there's nothing more extraordinary than powering smarter healthcare for everyone, everywhere. That's why we work towards the vision every day by helping to speed drug development, ensuring product quality and safety, improving commercial effectiveness, getting the right treatment to patients, improving access and delivery of healthcare, and ultimately driving better health outcomes. Lastly, there's this health, which I'm using health anthropology. There's the generic again as a material form of it, but it's not understood as a commodity in the sense that it's a low value merchandise. It's a high value health artifact. Diseases and health dynamics are also real material. And this is where the end user comes in. So I've taken this statement from participant of the research. She's identified here as M. She's 68. She lives in Rio. and she says, there are so many medicines I have to take. Sometimes I feel like I could just popping pills for my heart, for my head, for my liver. They make me healthy, I think, but sometimes I get nauseous. I don't know how well they mesh together. So this is showing a little bit of confusion and, let me say, how can I say this? Um, uh, Medicine consumer intake that is really high. So each of these dimension entities as well, they have different landscapes that I went throughout my ethnographic project and different actors. So state, the landscape is Anvisa, INPI, which is the National Institute for Intellectual Property, and the Secretary of Health. The market was the office of Company G, the factory of Company G, scientific and trade fairs as well, were an important part of the market circuit of the generic drugs. And the landscape in the health entity, it's the municipal health centers, consulting rooms, and homes of users of the unified health system in Brazil. They have different actors as well. The state is public official and institutions. Market is the company G. Sindus Pharma, Brasilan, Bifini Progenéricos, which are lobby companies that work with the big pharma companies in Brazil. And in the health entity, we have some other actors that are participating: physicians, pharmacists, health workers, the United Healthcare System in Brazil, and the users of the system. But what is a generic drug anyway? I tried explaining many times what is generic drugs and by itself, but all the different actors I encounter have different answers. So here I've made a little brief of what I'm understanding as the generic drugs. So I'm not just understanding the pills. Like I've said, packaging is a big thing in Brazil. They all look like this. It's written generic drugs, you have the big G and the yellow stripe. So packaging emphasizes public policy aspects. The pills are low value added goods. Packaged leaflets act as an important purifier, separating between moments. So it's an artifact that enables the generic drugs to jump from these different landscapes with different moralities to it and be purified, arrive to the end user or even the physicians as a purified object without any controversies. It allows the medicine to gain this natural quality to it. Um, so it's what makes the object appear as a natural process. And also the pills, which presuppose an individual healthcare, so a health model. So when I'm talking about generic drugs, the material aspects of it includes the packaging, the blisters, the pills, the active components, the package leaflet, and so on. So my research methodology is following the generic drug through the circuits it has traveled throughout its social life. I've engaged in a multi-sited ethnography to do so, and I rely deeply on material anthropology and science and technological studies to compose my methodology in an ethical manner as well as an engaged and political way. So, throughout this research, I have been able to identify what I'm calling here the long story. It would be somewhat of what Igor Kopitov's called the cultural biography of objects in his famous essay. So this story starts in 1986. This first moment goes until 1994. There are some major events that made possible for the generic drug markets in Brazil to appear as they do. Firstly, the Uruguay rounds, which were central to the making of the World Trade Organization, the emergence of the HIV and AIDS epidemic, new geopolitical moment, new models of industrial and intellectual property protection, and particularly in Brazil in 1990s, the creation of the unified health system. Through 1994 through 1999, In 95, there's the creation of the World Trade Organization. There's the TRIPS, which are new models of industrial intellectual property protection. In 1999, there's the creation of Anvisa and the promulgation of the generics law. Remembering again, Anvisa is the equivalent to the FDA in the United States. Throughout 2020 and 2024, there's an expansion of public policies, increase the number of generic medicines in Brazil, increase of consumption, expansion of the pharmaceutical industry, and new epidemics as well. I also have this short story, which is the generic circuits, that express better what my ethnographic field was. So there's these different moments of patent, production, distribution, sale, and consumption. You can pause the video right here if you'd like. I'm not gonna go through it because my time is already up, but I've separated into different landscapes, different temporalities, as well as different knowledges that are mobilized to understand the generics throughout its circuit. So if you want to pause, you can pause it right now, and I'll proceed to the next slide. Here are some partial results I can share with you. I'm glad to share about my PhD research. So state market and health have been understood as opposite categories, both in the common sense but also by a large part of the social sciences. The common understanding is that they have opposing interests and opposing areas of action. My research works in blurring the boundaries between these three distinct entities, in the meaning that they circulate both as ideas but also have distinctive material realities and solid social institutions. Through the generic drugs case in Brazil, while also taking into account the responsibilities of making them. It's about what word is enacted by generic medicine in each of those instances. So I want to express how these different entities and different actors have to work together in the make of what is a public policy, billionaire market industry, and as well as public health and public health interest for the end consumer. In pursuing the generic drug through its circuits, I was able to identify the existence of a generic market that is distinct from the market for branded and innovative drugs. So they are marketed to different people. They reach different end users. The fact that generic drugs are marked by the same name of the active ingredient of the drug means that they pass through different characters and landscapes than drugs marketed under a brand name. One of the arguments that I stand upon is that this market also constitutes particular and distinctive moral economies. These moral economies that the generic drug traverse produce different framings and articulate new tensions. Each time it is made or remade, the native mobilizations of the generic drug change, and consequently, the world enacted by them also changes. I want to thank everyone who watched the presentation. I also want to thank the American Anthropological Association and Praxis organization. I'm really glad to be here sharing my results with you. And I have to thank as well CNPq for funding my research and providing the necessary resources to advance my study. CAPES, which is supporting my internship here in the United States, enabling me to gain international experience and broaden my academic horizons. And I also want to thank my two homes, Federal University of Rio de Janeiro, my home in Brazil, and USC for hosting me during my internship here in the United States. Thank you very much for all of you. Please contact me if you'd like. I'll have some contact information be shown by the end of the presentation. Thank you.